Secretary of Education. I'd like to start out by introducing Henry Nicholas, President of the Union, and the visionary for our training fund. And then Pam Shadzik and Sandy Gomberg. Pam and Sandy are from Temple University's Health System and are founding partners of the training fund. And Pam and Henry are the co-chairs of our Board of Trustees, the employer and the union together.
I love it.
It's a very unique partnership. And Dr. Ackerman.
It's okay. I'm back here.
It's trying. It's hard to get through.
Hi, Dr. Ackerman. How are you? Dr. Secretary.
Good.
Dr. Ackerman is doing a phenomenal job with the School District of Philadelphia, and so happy that she's with us here today. We have Peter Gould and Michelle Mills, the Executive Vice Presidents of the Union.
Good to see you.
And Meg Jones. Meg is Vice President. How are you? And we have Stephen Krause. Where are you, Stephen? Stephen is one of our trustees from Hannah University Hospital. Gail Lopez Henriquez. Hi, our General Counsel.
Hi, good to see you. How you doing?
Good. And we have from United Way, if you'd like to come forward. Hello.
Hi, how are you?
This is Angie.
Nice to see
Vice
you.
President of United Way.
I saw you in Detroit.
And
United Way.
also Seth Green.
Hi, I am multitasking
here. National Fund of Workforce Solutions.
Good.
So we're so happy to welcome you. We're just thrilled to have you here today.
Thank you.
Heard great things. It's good to see you.
And we are going to take you on a tour of 3 classrooms. Right. So I think in general, Henry and I are going to lead the tour, and we just wanted you to meet our esteemed partners. I don't know if anybody wants to, Dr. Ackerman, say a few words or welcoming.
Well, this is spontaneous, but I'm always happy to welcome friends to the city of brotherly love and sisterly affection. We're really proud of what we're doing here with our partners, and I think you're going to be excited about some of the things that you see.
Thank you. It's wonderful to see the good ongoing relationship that's been happening here for the last few decades, and it's a good reminder of where we started and how things continue to grow and build upon that. So thank you very much for doing
Hard
this.
work 7 days a week.
Okay. Sandy, would you like to say a few words?
You sure? From Temple University Hospital's perspective, we've had 3 fabulous decades of partnership, and probably the most important piece of this is looking ahead as an employer about what's going to be the needs of our workforce as technology changes, as work changes, as systems change, and being able to have transparent conversations in the world of training and figure out how we best bring that education to the workforce so that meets both needs, that the employees can continue to grow and learn and progress in their career, and that we have the right workforce to make sure we provide good care to patients. So we're thrilled that the training fund continues to support us in that way.
How does it work? Like, your needs are changing pretty rapidly, I assume. How do you make sure that you're getting the employees you need and skills?
So part of the great thing about the relationship with the training fund and this sector partnership that we have is we're in constant dialogue with the training fund sort of as the intermediary and with other healthcare institutions to identify what are the trends, and then with them to identify sort of specifically how do we create training to meet those needs, and so that when the training is actually developed, it's very customized to the sector needs. And for example, a course might be contextualized so that somebody's not just going to prepare for a course, but it's contextualized within the possibility of the field that they're going to go into. And so it's not just somebody going for their GED in a vacuum. And so that kind of conversation and the training fund with the resources that it has is very powerful in creating sort of a win-win for both the worker and for healthcare. For our institution.
Can you give an example, like around maybe the mental health workers? Or?
So there are tons of examples. One of the most powerful ones in the last year is the training fund came to us as healthcare employers and said, we see, like, really, we know that electronic health records is changing your industry. And we said, yeah, you know, absolutely right. And they said, what kind of training do the employees need? And we were like, well, you know what? Honestly, this is the way we answered. We said, it's real, like, our vendors come in, the vendors who are putting in systems, they come in and train people. And the training fund really pushed back and said, it's more than that. We know the workers, they need more skills. We don't want people out on the street because of this. And educated us, so pulled together, did a symposium with educators and healthcare institutions, as well as the training fund, to really educate us into sort of the big picture of what this means. And as a result, Cheryl can say more about the program that came out of it, with credentialing, so that was so great that actually now we as employers can look back on it and go, there's pieces of that when the vendors came and trained our people, we missed. So so that program has been developed, and we can now even pull pieces of it to use in areas that haven't been used. So it's that constant conversation and customizing to our needs, but they're the ones who identify what are the themes and pull in all the resources. Otherwise, frankly, we'd be just doing it on our own in a less impactful way.
I think Peter wanted to.
Yeah, I think with regard to what Pam was saying, that there's a third party that has a voice in this, which is our members, their employees. And what Pam was talking about really arises, and this happens all the time, because people see changes coming on the job. They don't exactly know what they are, but they anticipate that it's going to mean something for them. They come to the union, and through us as a party to the training fund, we can get to work on that. And actually what happened in the case that Pam was talking about is that there was a conference convened here for members, actually whether they were participants in the fund or not, around the whole issue of electronic health records, and which gave rise to this, you know, pretty expansive training program, which many are participating in now to sort of prepare them for what they're going to be facing at Temple or at CHOP or other places.
The original vision is this gentleman's. In 1974, in the very first union contracts, he negotiated the fund with 9 employers, 0.5% of gross payroll, so that our members would not be stuck in dead-end jobs. And now we have 50 employers who contribute 1.5% of gross payroll. That's a significant expenditure. It's a significant expenditure that the members are sacrificing out of their paychecks and the employers are sacrificing. And that joint partnership is Henry's vision. That's great.
The most important part of it is that we have been able to use that 1.5% to leverage it to the various foundations, to the U.S. Labor Department, to the State Labor Department. And from that, we are able, each year our graduation is at the Kimmel Center, and at that graduation, 50% of the people graduating are not union members. They are from the community, which is a key part of it.
Great, thank you.
And the other important piece that I would have to say has been, since 2005, the state has funded us for an industry partnership, a healthcare sector-based industry partnership. And that has allowed us to expand beyond our contributing employers to include non-union employers, employers in healthcare that are not contributing, higher education, government representatives from the career link system, from the WIB. And so that industry partnership then has been key to really having more impact on the healthcare industry, the workforce needs, aggregating the training needs, and coming up with educational programs that are going to meet those needs. So what you're going to see today in the 3 classes you visit are classes that are designed really to be pipelines into the occupational training, but not pipeline adult education programs that are standalone, as Pam said, but are really integrated with occupational knowledge.
I really like that idea. I was reading the background and just how you've really been able to push out skills for new arriving immigrants that come to cities like this, and it's a good model to be able to integrate literacy aspects, and for ESL learners, it's so critical. We're finding that even just in the workplace overall, that people's literacy rates for dislocated workers is so high. And that model, I believe, I haven't talked to Artie about, but I'm sure he would agree that it's so important to have more flexibility in being able to deal with those populations.
And I think the other big accomplishment of the training fund is that we were then able to link our occupational training to the next steps, to the college credits, to the college programs. And so we have some pipeline programs, our practical nursing program into Community College of Philadelphia's registered nursing program, our behavioral health program that we designed with Temple into Philadelphia University's associate and bachelor degree programs, which the associate degree happened right outside here. We've had all kinds of opportunities then to link so that our students can go beyond just the industry recognized credential to higher credentials. And you'll actually, some of our teachers teaching today are actually the result of that higher level connection to the college piece. So we want to make, I mean, folks can come here from not having a high school diploma all the way through a college degree. We're really a one-stop for healthcare in Philadelphia. And I think having this facility, then offering the classes on site to employers, working with the school district. So we have a youth pipeline. Last year we served 400 youth here at this site. Putting all those pieces in place so we're meeting industry need, but we're also meeting the needs of the residents of Philadelphia.
How many folks are you working with each year?
So there are two numbers. We have about 5,000 students a year, both here and in our tuition reimbursement and scholarship programs. But we actually provide services to 19,000 people a year. We have open, free academic testing. You can walk in off the street twice a week. We serve 4,000 people just in free academic testing so that they can figure out where they need to get started.
Yeah.
We have our VITA tax preparation site. We're a nurse aid test site. We offer weekly several workshops exposing folks to careers in healthcare, providing career coaching. So we're really touching a lot of people. We had a summer health exploration program for the youth. We have a GED to college program for dropout kids from the school district. We're actually doing some intensive work at one of the health academies at Lincoln High School. We have a nurse aid program for out-of-school youth. So we're doing incredible kind of outreach to let the residents know that there are careers, there are jobs in healthcare, and we can help you get started.
And the gist of it is, it cannot be a 9 to 5. We are 7 days, 3 shifts, no excuses, and we work very hard at it.
We open at 7:30 and close at 10. We're here all day Saturday. Some of your advanced folks came on Saturday, so a very busy place here. And our LPM program also has Sunday hours. So
That's great.
yes. So would you like to, anybody else want to, would you like to proceed to our questions? Okay.